All right, let's talk about the world of diabetes medications. It can feel, well, pretty overwhelming, right? If you or someone you know has diabetes, you've probably heard a whole bunch of drug names that sound like a different language. So today, we're going to try and make sense of it all. We're going to organize everything into a simple, understandable framework.
So, you might be asking yourself, why are there so many different drugs? It's a great question. Why isn't there just one magic pill? Well, the truth is, diabetes isn't just one single problem. It's a really complex condition, and to manage it well, doctors need a lot more than just one tool.
So let's think about all these medications like they're part of a toolkit. You know, a mechanic would never try to fix a whole car with just a hammer, right? Same idea here. A doctor needs a whole variety of instruments to tackle diabetes from all the different angles. Each tool has a very specific job, and it's chosen for just the right situation.
Okay, so let's start with the first, and honestly, the most fundamental tool in the entire kit: insulin. It's the original, and it's still the most powerful way to lower blood sugar, period.
But how insulin is used really depends on the type of diabetes we're talking about. For someone with type 1, their body has pretty much stopped making insulin completely. So for them, taking it isn't a choice. It's absolutely essential for survival. Now for type 2, it's a bit different. The body is usually just having trouble using its own insulin, or it's not making quite enough. In that case, insulin is still a super powerful tool, but it's one that doctors pull out when other medications just aren't quite getting the job done.
This is such a good question. I mean, if it's all just insulin, why the crazy variety? Well, it all comes down to one thing: timing. The whole goal of insulin therapy is to mimic what a healthy pancreas does naturally, and that means you need different tools for different times of the day. See, to copy a healthy pancreas, we have different speeds of insulin. You've got your rapid-acting or bolus insulins. You take those with meals to cover the sugar from the food you're about to eat. And then you have your long-acting or basal insulins that provide the steady, low level of insulin in the background all day long. Using them together is what helps keep glucose levels stable around the clock. Now, as powerful as insulin is, it's a precision tool. You have to be careful with it. Using a little too much, or maybe not balancing it correctly with food, can lead to its most common and most serious complication. And that complication is called hypoglycemia, which is just a fancy word for low blood sugar. It happens when there's too much insulin in your system for the amount of glucose that's available. And that's a problem because your brain runs on glucose. So when your levels drop too low, you can start to feel anything from shaky and sweaty to really confused. And in severe cases, you can even pass out. The good news is hypoglycemia is treatable, and the steps are pretty simple. First, you have to recognize the symptoms. Second, you have to act fast. Drink some juice, eat some glucose tablets. About 15 grams of fast-acting sugar is the rule of thumb. And for those really severe emergencies, there's a rescue medication called glucagon that can bring blood sugar up very, very quickly.
Okay, let's move on. Let's open up the next section of our toolkit, which is a big one, especially for type 2 diabetes. Because while insulin is always an option, for a lot of people, the first line of defense comes in the form of a pill. And remember, with type 2 diabetes, we're really fighting a war on two fronts. The body is resisting the insulin it has, and the pancreas is getting worn out trying to make enough. That's exactly why we need different tools that can attack the problem from completely different angles. So tool number 1 in this category is the insulin sensitizer. The classic example is metformin. You've probably heard of it. It's often the very first medication someone with type 2 is prescribed. Its main job is to tell the liver to just quiet down a bit because the liver can sometimes overproduce sugar. It also helps the body's cells become more sensitive. Basically, it helps them get better at listening to the insulin that's already there.
All right, next up, we have the insulin secretagogues, like the drug class called sulfonylureas. So if the sensitizers help the body listen to insulin better, these guys give the pancreas a little nudge to produce more insulin, especially around mealtimes. They work directly on the cells in the pancreas, telling them, hey, release what you've got stored up. Now, for a really clever tool, the glucose blockers, or SGLT2 inhibitors. These drugs have a totally different strategy. They work on the kidneys, and they actually block sugar from being reabsorbed back into the blood. So instead, any excess sugar just gets flushed right out of the body through your urine. And here's the kicker. This doesn't just lower blood sugar. It also provides major, and I mean major, protection for both the heart and the kidneys, which is a huge deal. All right, now let's talk about the cutting edge. I mean, the last decade has brought a total revolution in diabetes care. We've got new tools now that are completely changing what's even possible. This is where the entire philosophy of treatment has shifted. We've moved beyond drugs that only lower blood sugar. The new goal is to tackle the whole picture, helping people lose weight, protecting the heart, and improving their overall metabolic health. And the drugs leading this charge are based on natural gut hormones called incretins. You've probably heard of them, GLP-1 agonists. They are a triple threat. They tell the pancreas to release insulin when you eat, they slow down your digestion to prevent those big sugar spikes, and they send a signal to your brain that says, hey, you're full. The result? Much better blood sugar control, significant weight loss, and proven protection for your heart. And the breakthroughs aren't just for type 2. For people who are at a high risk of developing type 1 diabetes, this is just incredible news. For the first time in history, we have a medication called teplizumab that doesn't just treat the symptoms, it can actually delay the disease from ever starting. It works by calming down the immune system's attack on the pancreas. And that delay is huge. We're not talking a few weeks here. On average, studies have shown it can push back a full type 1 diagnosis by about 2 years. Just think about what that really means. That's 2 extra years of freedom from daily insulin injections and constant blood sugar monitoring. It's a massive leap from just treating a disease to maybe, one day, preventing it. So we've seen that managing blood sugar is just one piece of the puzzle. A massive part of modern diabetes care is protecting the rest of the body from long-term damage. And that's where this final section of our toolkit comes in. We call it adjunctive care. And that's because, let's be honest, having diabetes significantly increases the risk for some serious stuff. Heart disease, stroke, kidney disease. So really comprehensive treatment plan has to include medications that are specifically designed to protect these vital organs. And this is our support crew. Think of them as bodyguards. Statins are pretty standard for managing cholesterol and lowering the risk of heart attack and stroke. And then you have blood pressure medications like ACE inhibitors or ARBs. They don't just control blood pressure. They have a very specific, proven benefit in protecting the delicate little filters inside the kidneys from getting damaged over time. So, to bring this all home, there is no one-size-fits-all approach anymore. The whole goal is to choose the right combination of tools from this kit for each individual person, not just to manage their blood sugar, but to help them lose weight, to protect their heart and kidneys, and to give them the best shot at long-term health. And that leaves us with a pretty fascinating question. I mean, in just a century, we've gone from having one single tool, insulin, to this incredible, highly specialized toolkit. So as these tools get even better, as we move from just treatment towards actual prevention, what will managing diabetes even look like in another 10 years? It's pretty exciting to think about.